All right. So today we're still continuing on with the cardiovascular system, and kind of part of our little vessels around our body include our lymphatic vessels. Okay. And so we'll talk about the lymphatic system a bit today, as well as some surrounding issues related to that. And one of those has to do with capillary exchange and swelling. So we'll kind of dive into that. Okay. So let's do a couple review questions here on osmosis. Okay, so a couple applications of osmosis. Go ahead, chat about this one just with the people around you. Find somebody to talk to. I know you're not with your team, but find somebody to talk to today. Chat about this and send in your answer. There you go. All right, a few more of you, go ahead and send in your answer there. All right, I think that's everybody. So we got about 85% of you saying B is the right answer. So after an ankle sprain, cell contents and other debris are all stuck in the interstitial space. So it's a good just to remember what the three spaces of the body are, right? There's really three spaces that we talk about. One of those is intracellular space, right? So inside of all the cells of our body, that's where the most of our water is inside cells. And then we have inside of our blood vessels. Okay, that's kind of space number two. And then we have everywhere else between those two things, which is called the interstitial space. Okay, so that's between cells and blood vessels, between cells. Okay, and that third space is where swelling happens. So when somebody has swelling or edema, it's in that third space, that interstitial space. And so when you have an injury like this, cells spill out all their stuff when they break, right? And then you have ligaments and other things that tear, and then that leaves debris in the area too. And you have the immune system that comes in and creates a bunch of extra stuff in that space, right? And all that stuff amounts to solute, right? So we have extra solute in a space, then that space becomes hypertonic, and then it draws water towards it, right? When it draws water towards it, it creates swelling, right? And so so the space is going to be hypertonic, and that's going to lead to water flowing out of cells and vessels into that space. So that's B. Okay, questions on that? Okay. Got a couple stragglers. Uh, okay. All right. Let's go to the next one. Another review question here as well. Just check with your buddies on this one and send it in. Yeah. You can sit wherever. All right. Go ahead and send it in if you haven't yet. This one we're a little more spread out on. Maybe double check with your teammates here on this one. Double check with the people around you. Try to convince them of your answer. We're kind of all over the place there. Let's try again. Change it if you need to. Oh yeah, I guess I didn't let you do choose all, huh? Yeah. That does play a role here. Okay. All right, so most of you are putting A and D. Okay, so eating a meal that's high in fiber leads to looser stool because. So most of you said A, which is we can't digest fiber, so it stays in the GI tract and pulls water in with it. That is true. We can digest fiber. That's not true. Fiber stays in our GI tract, leading to a hypotonic solution. Nope. But fiber stays in the GI tract, leading to a hypertonic solution. That is correct. So yes, both A and D are correct there. Yeah. Questions on that? Okay. All right. So let's just kind of continue this review on osmosis here. So the little brackets around the word solute mean concentration, right? So if solute concentration is high, if we're saying that, then kind of relatively, we're saying that the concentration of water in that same space is relatively lower. Okay. And then it's just the opposite. If a solute concentration in a space is kind of low, or considering it low, then that would mean relatively the water concentration in that area is high. Okay. And that's kind of what we're getting at here, is that these are relative terms, right? So when we're using terms like hyperosmotic, hypoosmotic, high osmotic pressure, low osmotic pressure, hypertonic, hypotonic, they're relative terms. So we have two spaces with a membrane in the middle. And if we're saying one is high, the other one must be low. Okay. And so they're always in reference to kind of a comparison fluid. Okay. So if a fluid is hypertonic, that means it's got high solute concentration and relatively low water concentration. Hyperosmotic, okay, same thing. All right. In that case, water is going to go towards that solution. All right. It's going to go towards the solution that is hypertonic or hyperosmotic. Okay. Then the opposite, if it's hypotonic, we've got low relative solute concentration, high relative water concentration. Hypoosmotic will be the same. Okay. In that case, water is going to go away from that solution. It doesn't have the osmotic pressure to hold on to water, right? Osmotic pressure pulls towards itself, right, when it's high. Okay, and then the isos, we have relatively equal concentrations of solute and water, and so no overall water movement is going to occur. Okay, looks like most of you are done writing. All right, so then when we, this is kind of what you already studied for the quiz on Wednesday, but hydrostatic pressure, the key thing to know about it is that it pushes, okay? This is like blood pressure, right? It's pushing. High hydrostatic pressure pushes against the walls of blood vessels, okay? Um, and so if we create hydrostatic pressure here by pushing this piston down, it can drive water through a membrane that has big enough holes for it, and it's going to push that water that direction, right? Osmotic pressure is the opposite. It pulls towards itself, right? So if we have a solution over here with lots of solute that has high osmotic pressure, then water is going to go towards that solution instead of away, like it did with the high hydrostatic pressure. Okay, so just important things to remember. Okay, so then when we look at a situation like this, yeah, this would be like a capillary wall, right? So this would be like a blood vessel here on this side, and this would be the interstitial space over here on this side, right? If the left side, solution A, has higher solute concentration, then it has higher osmotic pressure, right? And so the little water molecules are going to be drawn towards that side. And water is going to move towards the side with a higher osmotic pressure, higher solute concentration. Okay. So when we think about blood going through a capillary, we need to consider both of these two pressures to figure out which way water is going to move. Okay. So the fluid movement through capillaries, and how much fluid squeezes out of capillaries when blood passes through the capillaries is going to be driven by these two forces, by both hydrostatic pressure and osmotic pressure. Okay. But we need to think about these both inside the capillary itself and then around the capillaries in the interstitial space. So we got to kind of consider those four different pressures, right? So hydrostatic and osmotic pressure inside the blood vessel, hydrostatic and osmotic pressure outside the blood vessel. We need to consider those four things to be able to kind of decide how much fluid is going to leave or come back in the capillaries. Okay, so the hydrostatic pressure in our blood vessels is always going to be highest on the side that's closer to the heart, right? Because our blood pressure was created by our heart, right? And so blood's going to go out the aorta, through some big arteries, through some smaller arteries, down to our arterioles, right? And then to our capillary beds, right? So that first part of the capillary bed is going to have the highest or hydrostatic pressure because the blood pressure is on that side of the vascular system, right? And then as it passes through the capillary bed, that hydrostatic pressure is going to be dropping, okay? And so it's going to be lowest closest to the veins, okay? So blood pressure drops as blood passes through the capillaries. And most of that is because water's leaving. Fluid is leaving as blood passes through our capillary beds. And the osmotic pressure is pretty much going to stay the same. If we don't have a damaged capillary bed, then for the most part, the thing that creates our osmotic pressure is the proteins in our blood. So that albumin, plasma protein we talked about last time, that's the primary thing that gives us osmotic pressure in the blood. Yes, solutes are a part of that too. Sodium and things like that are part of our osmotic pressure. But a lot of that's going to be going with the water in this to the same proportion. So it doesn't really change too much as the water leaves, the sodium goes with it, right? So the big thing is that the fact that we've got those proteins just staying in there. Okay. All right. So when we look at this example here, so we've got our blood coming in on the top there. That is going to be the arterial, and then you can see how it goes down. Okay. So just real quick with the people next to you, check in on that on those two clicker questions, those two questions there. Where's hydrostatic pressure the highest? Where would hydrostatic pressure be the lowest? Okay. And you can just send in this one right here. Where would hydrostatic pressure be the lowest? All right, go ahead and send in that answer. A couple more of you. Okay. Yeah, so most of you are saying B. Okay, that's the one that's kind of furthest away from the arterial side, which is correct. Okay, so where it would be the highest would be A, right? Lowest would be B. Okay, the thing that we can see here is overall, if we add up all the fluid that leaves our capillary beds in a full 24-hour period, on average, the amount of fluid that leaves with all those little arrows going out in all the capillary beds is about 20 liters of fluid. Okay, that's a lot of fluid. How much blood volume do we have? Yeah, maybe 5 to 7, something like that, somewhere around that. So that's way more than our blood volume, right? So what that means is most of that has to get recovered, right? And you can see that it does. So 20 liters leaves, but then by the time that blood gets to the other side of the capillary bed, 17 of that liters of that fluid has already came back. Okay, but that leaves 3 liters, right? There's 3 liters there that didn't get recovered, and again, that's half or more than our total blood volume, right? So we definitely can't afford to lose 3 liters of fluid every day, right, to the interstitial space. So this is where the lymphatic system comes in, right? This is the importance of the lymphatic system is recovering that 3 liters of fluid for us, right? And so we can see this little lymphatic capillary here. That's what's going to pick up this extra 3 liters of fluid that we didn't get back on the other side of the capillary bed, and it's eventually going to help us get that back to the heart. Okay, so let's take a quick look here. We can actually calculate what's called net filtration pressure, which is really just our hydrostatic pressure minus our osmotic pressure. Okay, we can calculate that on the arterial side, and then again on the venous side of the capillary bed. Okay, so go ahead and calculate that with the numbers you've gotten there. Okay, um, and yeah, and you can kind of see what the driving force is there. And you can go ahead and answer this question here on your clickers with these answers. But yeah, calculate those two pressures. You have the net filtration pressure on the left side, and then again on the right side. Yeah, and then you can answer that question on the right there that I circled on your clickers, but answer them both with the people next to you. Okay, so double check with the person next to you. You got those two numbers as well as the two questions up there. Which one is the driving force on the arterial side? Which one is the major driving force on the venous side? Okay, one or two more people, send it in. All right. Okay, so I think we got everybody. So about 30% of you are saying B, and then the other 70% are saying A. So let's look at these pressures first. So this first one is just simply 35 minus 22. What does that equal? 13, thank you. 13. Okay, so we have a positive 13 right here. Okay. When we have a positive number, that means water's going out. Okay. So positive number inside the blood vessel means water's going to move out. Okay, because the hydrostatic pressure is overcoming the osmotic pressure. Right? Osmotic pressure is trying to hold on to the fluid. Hydrostatic pressure is trying to push it away. If we got more hydrostatic pressure than we do osmotic, then water's going to go out. Okay. And then our number here, what do we end up with? Negative what? 7. Thank you. -7. Right. So now it's the opposite. Right. So now our osmotic pressure is overcoming the hydrostatic pressure. Right. So the major driving force on the arterial side is going to be our hydrostatic pressure, but the major driving force on the venous side is going to be that osmotic pressure.
It's all H2O.
Say that again.
It's only H2O.
That's moving.
Yeah.
Yeah, and well, it's not just water, but there's also the solutes that are small enough to go through the holes. So like, yeah, just the little holes between the endothelial cells here. And so that would include salts and oxygen and CO2 and all kinds of stuff like that. So all the things that we exchange when we go through a capillary bed is going to go with the water through those little gaps between the cells. Yeah. Yeah.
Um, are the answers to these always the same, or does it depend on the meters?
Um, you mean on the top part there, on the top right, those questions? Yeah. The answers there are typically the same in a normal capillary bed under normal circumstances. But we'll talk about some examples at the end here where we have abnormal circumstances with pathologies, and that can change things a bit for sure. But under normal situation, that's pretty much going to be the scenario that we're in. Yeah.
So just, I looked at the slide before where it said osmotic pressure stays the same. So
Yeah.
that's not when I was talking about the same thing.
Osmotic pressure was 22 here, and then it's 22 there. So that's what it's talking about, is osmotic pressure staying the same. Hydrostatic pressure drops because fluid leaves, right? But osmotic pressure doesn't change because those proteins are too big to get through those holes and they don't move. Yeah. Good clarification. Yeah. Other questions on that? Yeah, Jamie?
Too far back, but to
Yeah.
the last exam,
Yeah.
did we talk about the vessels inside the capillaries that bypasses when the pressures are equal?
We talked like you're talking about the shunts or the meta arterioles. Yeah. Yes. So this would be an example of when the capillary bed's open, right? And this is blood going through the capillary bed. This would not be when blood is kind of skipping around the capillary bed. But yeah, yeah, good connection. Yeah, Lana? Hmm. Yeah, for sure. Yeah, so when we have, so if this capillary bed happens to be like one that's like embedded in a muscle that you're contracting, which we have capillary beds all throughout our muscle, right? When we're contracting at that moment, um, it just smashes the capillary bed down. There's no blood going through it at all. Pretty much. Yeah. 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 So that's really common for sure. And that's part of the pumping that occurs to help us over here to push blood back. But no blood's actually going to get through there when that muscle is contracted. So, yeah, great question. Other questions? Okay. All right, so then a little bit more about the lymphatic system here. Then we'll talk about some of the vessels and organs that are a part of the lymphatic system. Okay, so the purposes of the lymphatic system, number one, is the one we've already mentioned, which is recovering that 3 liters of fluid per day. Okay, and it's not just the fluid, but it's the stuff that was in the water too, right? It's the solutes, so nutrients, gases, hormones, proteins that were small enough to get through there. We want to get that stuff back, right? Again, total blood volume is only about 5 to 6 liters. So 3 liters is of incredible importance to us. Okay. Um, Another purpose of the lymphatic system is fat absorption. We'll talk about this when we get to the digestive tract a little bit more. But fats that we eat, we break down and we absorb. We don't put them right into our bloodstream. We put them into lymphatic ducts instead of our bloodstream. And then lastly is main role of our lymphatic system is to house a lot of our leukocytes, our white blood cells. And so those would be the lymphocytes are specifically called that because they're found in lymph nodes. Okay. I might close that door. We're doing that. Okay. All right, so the lymphatic vessels that we have are somewhat similar to little veins. Okay, they have little valves in them like veins do, but they're only moving towards the heart, just like veins. Okay, but they're super leaky, so they have big gaps between the cells, um, and that's how water and fluid enters into them. Okay, and so the order of flow is we have capillaries, lymphatic capillaries, which are just kind of woven all throughout our regular capillary beds. Okay, and then those will feed into collecting vessels, which will feed into collecting trunks, or sorry, just into trunks and then into ducts, lymphatic ducts. Okay, the one unique part about the capillaries in the lymphatic system is they're anchored to the surrounding tissue. And so when fluid starts filling that interstitial space, with our capillaries, when fluid fills in it with our normal capillaries, when fluid fills the interstitial space, that smashes down on our capillary beds because it creates pressure on the outside. But with lymphatic vessels, it does the opposite. When the cells kind of get pushed out because of that fluid, the sides of the vessels are anchored to those cells, so it opens up the lymphatic vessels instead, and that's just helps them serve their purpose in gathering that fluid that's filling that space. Yeah, and so those collecting vessels, the ones here, kind of similar in size to our veins, but they have a lot more valves, very thin walls, and there's very, very low pressure in here. Arterioles had pretty high pressure, right? Venules had very low pressure, but even lower than the pressure in the veins is these lymphatic vessels. Okay, so the fluid is just kind of like barely kind of creeping through the lymphatic system, making its way back to our bloodstream. Okay. All right. So yeah, this is this is kind of what it looks like. So we can see where those lymphatic capillaries are. They're just kind of woven all throughout our regular capillary beds. Okay. And then we can see that those collect to these big collecting, connect to these big collecting lymphatic vessels. All right. And then we can see some lymph nodes along the way. We'll talk about those in a second. And then those are eventually going to dump back into the venous system. Yeah. So lymphocytes are mostly found in lymph nodes. And so lymphocytes are the three main ones we'll talk about will be our B cells, our T cells, and those natural killer cells that we talked about will be lymphocytes. Okay, just a little bit more about these ducts and the way that the flow works. So the function of the ducts is just to return the lymphatic flow back to the blood. Okay, and we have these large vessels that will dump into some of our big veins. So the thoracic duct is lymph from most of the body, and it connects right into our left subclavian vein. Okay, so there's a little hole in the left subclavian vein that this lymphatic duct just connects into, dumps all that lymphatic flow right there. Same thing on the other side, but it goes into the right subclavian vein instead. Okay, so the lymph flow is helped out immensely by the fact that there's so many valves in these little vessels. Again, by muscle and thoracic pumps. So when muscles are contracting around it, creates some pressure, smashes them down, and then pushes the fluid kind of on both sides, right? And the veins help it, or the valves help it go in the right direction. And then there is some smooth muscle around lymphatic vessels as well. Okay. Questions on any of that? Okay, so here's we can see where those big vessels are. So that right lymphatic duct, you can see right there where it just pokes right into the right subclavian vein. Okay, and then the thoracic duct just goes right into the left subclavian vein. We can see how that connects there. So that's just how we recover that fluid, right? It goes into these big vessels and then dumps in back into our veins. Okay. All right, so a little bit about lymph nodes. Lymph nodes, we have some around 500 to 600 of these in our body. Okay, these are kind of helping to filter that fluid before it goes back into our veins. Okay, and so in the lymph nodes we have lymphocytes, right? But we also have macrophages and other immune cells there that are pretty much there, just kind of like checking the fluid as it passes through. Right, as this fluid passes through, these immune cells are just kind of monitoring what's passing through. And so this is a place where when we get an infection or we get a cold or something, these swell up, right? They get bigger because the immune cells in there have interacted with a virus or whatever it is, and then that makes them divide, and we get a bunch more of those immune cells, and they're starting to fight that infection there, right? And that's kind of the epicenter for the attack against whatever it is that's inside of our bodies that we'll talk about when we get back from break, when we get into the immune system more. But yeah, so we can kind of see the lymph is coming in on this side, right? It's got to pass through all of these little collections of lymphocytes. And while it's doing that, the fluid is just interacting with everything that's in the fluid. And then it's going to empty back out and continue on through. Okay, so there's lots of clinical applications with lymph nodes. Okay, I just kind of talked about why they get enlarged, but when they're fighting some kind of infection or invader, they swell, right? And they swell because that's an increased number of the immune cells there, right? So those immune cells get activated when they interact with a bacteria or virus or whatever it might be, and then that makes them divide, so then we get a bunch of them all fighting against that one specific thing. Okay, so we've got a bunch of lymph nodes that we can palpate, we can feel normally. And then that's one of the first things that the doctor or nurse practitioner or PA, whoever sees you when you go in because you had a cold for a long time, where do they usually touch you on your face? Yeah, right under your jaw, right? They go, oh, let me see how you doing. Oh yeah, I can feel, right? And then sometimes back here, right? You can see the ones kind of back here. But yeah, this one is the most common probably for them to feel. And then around your sternocleidomastoid muscle, you've got a couple there kind of on both sides right? So they're just feeling for that swelling, seeing if your body's fighting an infection, pretty much, right? They're also used for diagnostic purposes with cancer, right? And so if you have a tumor that is releasing cells and those cells are kind of spreading all over the body, then there's a good chance that you're going to find some of those cells in a lymph node, okay? And so if somebody has a tumor, for example, breast cancer, then they're going to check lymph nodes close to the breast, right? They're going to see in that area, they're going to pull one of those lymph nodes out, or pull a chunk of that lymph node out and see what kind of cells they find in there. Okay, so if they happen to find, if they just find lymphatic cells, cells that are supposed to be there, then that's okay, right? If they find cells that aren't supposed to be there, like a bone cell or a lung cell or a mammary tissue cell, then they know that the cancer is starting to spread, right? And that's what they're looking for with those lymph nodes. Okay, you can also have lymphoma, which is cancer of your lymph node, right? And so then it could be that yes, you found lymphatic cells that are supposed to be there, but they can test them and find that they're kind of growing uncontrollably, and that's the lymphoma, right? So yeah, so lymphoma would be a tumor of that lymph node. Okay, metastasis is when the cancer is spreading. Right. And so that's when they go into that lymph node and they find a cell in there that doesn't have any business being in there, like a bone cell or a lung cell or skin cell or whatever it might be. Right. Questions on that? Yeah.
So does that mean that
Yeah, typically, that would tell you what tissue at least is the cancerous tissue. Doesn't necessarily tell you exactly where in the body that came from. Like for something like skin, it's like, yeah, who knows, right? You got skin everywhere, bone, same thing. But sometimes there's also a mass in that area that you can find, right? But then, so a lot of times that's where it will start will be oh, somebody does have a mass somewhere, right? But then they go check the adjacent lymph nodes just to see if that mass is spreading, or if not, if it's just all staying in that one spot. And that would be like a benign tumor, right? If there's no spreading. But if it's a metastatic tumor, then that means it's starting to spread through the body. Yeah. Um, other questions on that? Yeah. Yeah.
People always be like, oh, if you have like swollen lymph nodes in your armpits and you have like mono, why?
Yeah, that's kind of just an oversimplification. It's really any infection your body's fighting. But yeah, some certain infections do make, your lymph nodes swell more than others. But that is a common thing with mono. But then they're also going to check your spleen too, right? And that mono does make your spleen enlarge. You'll see in a sec that the spleen is part of your lymphatic tissue, actually, right? And it's growing because of the same reason that the lymph nodes are growing. And so, yeah, kind of a couple tests would get you there, not just seeing that the lymph nodes were swollen, but the spleen and then some other blood tests as well to check for mono. But yeah, definitely a sign of any infection is those swollen lymph nodes. Yeah. Other questions? Okay, so then we've got some other little organs that are part of our lymphatic system, and these are called tonsils. Okay, and so a tonsil is just an aggregation of lymphatic tissue, and these tend to be in places in our body where things can come into our body. Okay, so they typically form this kind of ring of protective tissue around certain areas, and one example is around our mouth. Okay, and so in our mouth we have the pharyngeal tonsils. Okay, these are also known as our adenoids. Okay, adenoids are kind of at the junction of our nasal cavity and our pharynx, right? So they're kind of right here, kind of in the back of our nasal cavity. Okay. And when somebody gets an infection, they can get swollen, and then that makes it hard to breathe through your nose. Okay. We also have the palatine tonsils, which are the ones that everybody knows of as the tonsils. Right? How many people have had their tonsils removed? A few. Yeah, it's becoming less and less common for sure, because they do have an important function. Their function is to help us mount an immune response against something that's coming into our throat. Okay. And so we can live without them, but they do help to kind of activate our immune system. But people that get strep throat over and over and over and over and over again, sometimes it's better just to get rid of them. And so, yeah, enlargement. Oh, sorry. Yeah. Yeah. That's what I said. Difficult to breathe. Enlargement of the palatine tonsils is when we get this sore throat and it gets real swollen. That's what it looks like when you got strep throat, right? Is those kind of swollen and then a little bit pus. There's that white coloring of those. Yeah, and so they're not typically removed anymore because they do serve an important immune function. Because it makes sense to have a bunch of our immune cells kind of right in these places where things can get into our body, right? So we can quickly mount an immune response against those things. Okay, and then we also have the lingual tonsils, which are kind of on the underside and kind of back part of the tongue. Okay, the spleen is also considered a lymphoid organ. Okay, and it has two parts to it. It has the white pulp, and this is the lymphatic part. So this is where the lymphocytes are. This is where lymphocytes proliferate. Okay, so this is part of helping to develop our immune system, especially when we're kids. Okay, but it's not our typical lymphatic function. It's just more immune cell proliferation and maturation. Okay, and then we have the red pulp of our spleen, and this is helpful in helping to form our red blood cells in fetal development. Okay, and then in adulthood, when our blood passes through here, if our red blood cells are getting kind of old and non-functional, then they can get kind of snatched up here by macrophages that live in the spleen and help to recycle those red blood cells. Just the same process happens in the liver as well. And it's also a storage site for our platelets as well. So we kind of have excess, kind of a reservoir of extra platelets in our spleen that can be released when our platelets go down for some reason. So if somebody gets a ruptured spleen, which is the risk with mono, right? Mono causes enlargement of the spleen, which makes the spleen really tight. And then that's why typically somebody who has mono can't go back to contact sports for quite a while, because if your spleen gets hit hard when it's really swollen and it breaks, you can bleed out internally, right? Because there's so much blood in the spleen. The spleen's main job is to deal with blood in multiple ways. So it has lots and lots of blood in the spleen. So you can bleed to death if your spleen ruptures. Yeah, Riley. If you fall. Yeah, pretty much it. But yeah, I mean, there is a little bit of a risk of just the bouncing, but typically it's mostly just the contact that they're mostly worried about. But yeah. Other questions? Okay, and then we've got the thymus, which we've talked about a little bit already. The thymus is this endocrine organ that wraps around our bronchus, the big air pipe that goes down to our lungs, right? This is where lymphocyte maturation occurs. So developing our immune system, it's going to release two important hormones that are responsible for immune cell development, which are thymosin and thymopoietin. And these are going to stimulate the development of our white blood cells, our immune system. And so when we're kids, this is a big gland because it's doing a lot and we're developing our immune system. And then it slowly shrinks down as we age because we just don't need it as much after our immune system is kind of fully developed. So you can see it's kind of tiny there in that bottom image. Okay. And we've got a couple other organs related to the lymphatic system. We have what are called Peyer's patches, which is little clusters of lymphoid tissue that are housed kind of on the walls of our intestines. You can see those here. Okay. And the function of these is just to, again, prevent bacteria that we might have eaten in our food from getting into our bodies. And if it does pass through there, then that can activate our immune system and we can start mounting a response against it. We can see those Peyer's patches here in a microscopic image as well. The appendix is clumped into these types of organs as well. It's just this little offshoot on the first part of the large intestine. You can see it right there. Similar function as the rest, destroy bacteria, help build up the immune system. McBurney's point is the point at which that it hurts when you have an appendicitis. Has anybody had their appendix removed? Yeah, I don't know. That's right. I think, yeah. Yeah. So was it like pretty emergent situation with you, Lexi? Yeah. Oh, like in college? In high school? Wow. Okay. Oh my gosh. Did they have to like call 911 at that point, or you just? Yeah. Dang. Yeah. Was it pretty painful when it burst? Yeah, I bet.
That's why I never took calculus.
Oh, you never took what?
That's why I never took calculus.
Oh, yeah. Okay. Yeah, that's true. That is scary. Yeah. Yeah. Wow. I'm sure that was painful. Yeah. Yeah. So the McBurney's point is this point right between your anterior superior iliac spine, which is right here, and your belly button, but it's kind of 1/3 of the way. So it's kind of about right there on the right side. And it's kind of like this rebound test that they do when you're laying down, they kind of push down and then like let it up. And that's one of the possibilities for what's going on if you have pain right there. Don't go self-diagnosing yourself if that's your only symptom, but they'll check in other ways as well, like scans to see what's going on in there. So questions about that at all? Okay. All right. So we're going to spend a little bit of time talking about swelling or edema. Okay. Edema just means accumulation of fluid in that interstitial space. Okay. And we'll just run through some different causes of it here. Okay. So cause number one could be high blood pressure. Okay. Hypertension is a form of increasing our hydrostatic pressure, right? So if we got high blood pressure, and we go back to this image here, right? We're changing this 35 to a higher number, which means we're changing this 15 to a higher number as well, right? And so then the point at which, as we're passing through here, that we switch from water going out to water coming in is going to get pushed to the right a little bit, right? That's just the math of it, right? And so then that means instead of having 3 liters of fluid that the lymphatic system has to recover, we've probably got a little bit more than that, right? Because we're just moving that point at which water returns a little bit further down. Okay. So that's hypertension. Liver failure leads to something called ascites. Ascites is this right here. How many people are watching The Pit? Yeah. Okay. Season 2, episode 3 and 4. There was a guy that were draining his ascites. You guys remember that one? The alcoholic guy? Yeah. 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 They just had like bottles and bottles of fluid coming off his stomach. Yeah. That's what it is. That's ascites. So liver failure leads to 2 separate things that mess with that cause swelling. Number one is portal hypertension. So that means high blood pressure in the liver. Okay. The reason for that is because our liver starts breaking down and the cells get replaced with scar tissue instead of functioning cells. And so then blood vessels are kind of weaving their way through scar tissue instead of a nice clean path through the cells. And that creates a bunch of turbulent flow and creates high blood pressure. So high blood pressure there, so we're increasing hydrostatic pressure. And then the liver is responsible for making our albumin, right? So when our liver is not functioning properly, we don't make as much of that important plasma protein albumin, which is what creates our osmotic pressure. And so we have low osmotic pressure and high hydrostatic pressure with liver failure. Okay, we may have leakage of plasma proteins into the interstitial space due to injury, right? This is kind of what we were just talking about with the ankle sprain. Okay, kwashiorkor. Kwashiorkor is from the language used in Ghana, which is Ga, and it's translated as the sickness the child gets when the baby comes. And the reason for this is because when when people don't have it in Ghana and other places where there's just not a lot of nutrients available, the mom will breastfeed the baby as long as possible, right? Like up until 2 and 3 and 4 years old, because that's the best source of nutrition available. But if another baby comes, right? If mom's pregnant and has another baby coming, then that baby's going to get priority, right? And so then the toddlers end up being malnourished, right? And they it's just pretty much a low protein diet, right? If you don't have protein in your diet, then you can't make albumin, you can't make the plasma proteins, and so you're going to end up with low osmotic pressure in the blood, which leads to swelling and a different form of ascites like this. And then also we could kind of have problems with our lymphatic drainage. This could be injuries that mess with our lymph vessels or lymph nodes. It could be after we've removed a lymph node for diagnostic purposes. There could, obviously could be some swelling around there. Also have certain parasites that tend to like to go into our lymphatic vessels and destroy them a bit, and that can lead to swelling as well. So yeah, just all different causes of edema. Okay, so let's take the last few minutes here, and I want you to just run through these 4 scenarios, okay? Kind of what's the underlying problem with each, what is going on with hydrostatic pressure and osmotic pressure, okay? It could be in the vessels. In a couple of cases, you might want to talk about the pressure outside of the blood vessels, right? And then kind of as long as you're understanding why there's edema occurring, okay? So just walk through each of these with the people next to you, and we'll come back together in just a sec. Where are you headed, Alexander?
Just back home. That's not control this area.
Oh, okay. Thought maybe you get on a plane, got your big bags there. All right, double check with the people around you, make sure you got the same idea here. All right, let's go ahead and walk through this briefly here. So ankle sprain, we've been talking about that one a lot already. So the underlying problem is kind of excess solute in the interstitial space. I'll just say IS for interstitial space, okay? And so that's from the cells that broke, from the structures that got damaged, right? And so the hydrostatic pressure doesn't really change. So we can say not much of a change there. But osmotic pressure does, not necessarily in the vessels, but we would have increased osmotic pressure in that interstitial space, right? That's the big problem with this one, is the interstitial space. Osmotic pressure goes up because of all the extra solute there. And that's what's going to lead to the fluid flow. Okay, hypertension. Obviously, the problem is high blood pressure. We're going to have increased hydrostatic pressure in the vessels. Not really going to change the osmotic pressure in the vessels, and that's going to lead to the edema. Kwashiorkor is going to be a low protein diet. So the hydrostatic pressure in the vessels doesn't change much, but the osmotic pressure in the vessels goes down because we can't make albumin, and that's going to lead to the edema. And then lastly, with liver failure, we have increased hydrostatic pressure because of the scar tissue. And then we have decreased osmotic pressure because of the decreased albumin. And so those two things together are going to be the combo that leads to the fluid flow out of the vessels into that interstitial space. Okay, all done, guys. We got it. Have a fantastic spring break. Get some rest, have some fun. We'll see you guys when you get back.